we talk about the dissatisfaction of doctors in the healthcare system. And I honestly, I don't know any doctor in the traditional system, which I know hundreds of them personally.
Right.
Maybe I've met 1,000 of them. I don't know, but I've never talked to one that likes the traditional system. And, in DPC, I've met probably hundreds of them, and I haven't met one that doesn't like it.
That's right.
And think about how important that is as a patient to have a happy doctor. I mean, seriously, that might sound like obvious, but I don't think most patients realize how much most doctors hate the traditional system, because their hands are tied in the traditional system. They are told what to do, what to order. They're not working for the patient. They're working for an insurance company. And usually a big corporation that is paid by the insurance company. So they're not working for the patient.
That's right. Yeah. I mean, they both, there's a reason that, the doctors don't like it. The patients don't like it. It's interesting, actually. There's a large growth rate in DPC is actually coming from employers saying, "Hey, why don't we pay for this? This seems like a good idea. Let's just pay for this on behalf of our patients and basically let the doctors do what they're going to do." Well, it's interesting. The employers also don't like the status quo system, but they're captivated. They're captured by it, right? And I'll even go so far as saying the payers don't like the system they're in. But a lot of the people that work, maybe if you look at the system likes it because the system generates lots of money and people adopt that system. But when I talk to innovative entrepreneurial people all the time that have come from the status quo kind of third-party payer system on the payer side, and they hated it as well. They were like, I felt like I could have. It's not like there's just a bunch of bad people that working at Sickened or whatever that just want to screw everything up. They're just in the system, and so they don't like it either. And a lot of them actually leave to try to start companies. They'll often find us and we'll figure out, hey, is there a way to partner and figure this out? So the way I tend to think about it is, it's really the entire, all of the entities in the healthcare system, all of this kind of, if you think of it from a game theoretic perspective, all of the players, right, in the game don't like the game, but this is the game,
right?
And so the way I tend to think about it, the only way to fix a system that is that scaled up to that level with all of these actors and players that are sort of in this complicated, Dave Chase calls it a root Goldberg machine and combined with a Gordian knot, basically like it's an untiable knot and it's this complex machine, right? If that's the status quo, right, the only way to break that status quo is you have to just completely start from scratch. And that's why I think the sort of free market movement and DPC especially, because that's the most important part of the healthcare, from my perspective, system is the primary care system. It's the primary, from my perspective, you need to fix that. And then slowly but surely you can rebuild the system around those new incentives, those new, you've got this price transparent, incentive aligned, very low administrative overhead model. And if you think about the status quo, it's perverse incentives, no price transparency, crazy overheads. So you sort of fix all those things in a net new model, and then you can start from there to rebuild the system. And so that's kind of, it's not just the doctors, it's not just the patients, it's everyone. But I think the doctors honestly are the ones that get the worst deal, and because they're, they went into medicine to support and care for people, and they're not able to do that in a traditional model. And so that's actually a form of kind of, Z-Dog calls it moral, he says basically a form of moral injury being applied to the providers in the system.